Hello everybody, my name is Dr. Niket Sheth and I am the Medical Director of All for Eyes Eye Hospitals in Vashi, Navi Mumbai and in Khopoli. I am basically a cataract surgeon. I do cataract surgeries and also a general ophthalmologist. I see patients in the OPD which are newborn, also toddlers, also teenagers and also old age and geriatric patients. Today we will talk about young patients or newborn patients. When a baby is born in a house, there is joy and very happy atmosphere. And slowly, mother and father starts observing the baby. So many people ask me how to take care of a newborn baby's eyes. So mother and father, number one, they should be observant towards the baby's eyes. So now what should they observe in the baby's eyes? They should observe the pupillary area. They should watch for pupillary area of their baby's eyes. Now what is the pupillary area of the baby's eyes? The pupillary area is the center part of the eye within the black portion of the eye. What should they watch for in the pupillary area of the eye? They should watch for any whitish cloudiness or any haziness within the pupillary area of the eye. And if they find something like this, they should definitely go and visit a pediatric ophthalmologist. Other things which they can search or observe for in the baby's eyes are whether there is any discharge in the corner of the baby's eyes. Sometimes there is a discharge in the corner of the baby's eyes near the nose. This indicates that sometimes what happens is the canal between the eye and the nose does not develop fully or sometimes is closed, which over a period of time usually develops by massaging the corner of the nose. Now, while massaging the corner of the nose, mother or the father should be very careful that their nails should not be very sharp, or they should not hurt the baby's nose or eyes with their nail, or they should be gentle while massaging the baby's eyes. So number 3 is they should avoid giving baby very sharp toys to play, which the baby, when it does a little jerky movement, might hit the baby's eyes. And if at all they find any squinting or turning out of any eye of the baby, which sometimes is natural, it goes away with some a little time, but if it still persists, they should definitely go and visit the ophthalmologist. Now let's talk about the eyes of children in the age group of 2 to 12 years of age. So many people ask me, when should we check the eyes of our children? Every child needs an eye checkup regularly. I always suggest all the parents to not wait for complaints. So many people wait for complaints to arise from the baby or the child that he is unable to see, and wait for such complaints. I always tell them, do not wait. So many people wait for complaints to come from the school. Some teacher will tell them that your child is unable to see on the board or locate certain objects on the board and always wants to come and sit in the front bench. These are telltale signs that you have to go and check for the eyesight of your baby. So I always suggest everyone that all babies' eyes or all children's eyes need to, between the age of 2 and 12, need to be checked every 2 years or certain interval of that place. Now, after coming to a doctor, everyone expects their child to look and see everything on the first go. Sometimes it doesn't happen. The child is a little scared, so it is a little apprehensive. So you have to consider that, and sometimes the whole checkup does not happen in one visit. Sometimes you will have to come again and put some eye drops in the eyes and again see the baby's eyes or children's eyes. Now many people also ask me whether the spectacle number for a baby is a disease of the baby's eyes or a child's eyes. I always tell them that it is not a disease like fever or any jaundice to the eye or something like that, for which I will give some medicine and it will go off. Usually it is not a fever or any disease of the eye, it is basically an error or refractive error of the eye, so which can be corrected with spectacles. Once the baby starts wearing the spectacle, he will see clearly, he will see better, and he will learn more faster. So this will only help the baby in growing very nicely and very healthy lifestyle. Finally, hope you all have understood whatever I have said. I wish a very healthy and happy life for all the children, and a good diet always helps in a healthy and happy life for the eyes of the children. And if further any queries, you can definitely contact me on lybrate.com. Thank you.